As I have said, one of the things that you need to be the most careful about, because the symptoms so closely look like dementia, is infections. We talked about urinary tract infection. Here's another big one, not as well known and not as common: aspiration pneumonia. Dad had been taking care of Mom for a couple of years. She did have dementia. One morning, she managed to figure out how to use the phone when she saw him curled up in fetal position on the floor. I ran over. By the time the EMS got there, he was doing much better. He was a little confused. They had to convince him to go to the hospital. Thank goodness they did. I got a call. He had aspiration pneumonia. Now, what that means is that his esophagus was not opening properly when he was eating and drinking. Therefore, some of his food was getting into his lungs, of course, causing an infection, leading to pneumonia and what we had. Got Mom situated, could only be gone for half an hour. Went to the hospital, expecting Dad to be clothed, ready to go. We'd rush out of there and get home on time. I turned to the nurse's station, and in front of it, there was a man, an old man, tied to a chair in a hospital gown with his arms wildly flailing. It was my dad. Ooh. When I recovered from the shock, I talked to the nurse. I couldn't possibly take him home. I certainly wasn't going to leave him tied up all day. I called a friend. She went to take care of Mom, and I settled in to spend the day with him until he got to the point where he would stay in bed and didn't have to be tied down. But that was my biggest problem. My biggest problem was that the doctor kept coming in and telling me that I had to take him home. Now, I've worked in the medical field, mental health, but we have hospitals too, to know that the reason they wanted me to take him home was not because he wasn't gravely ill, but because it was Sunday. And if they didn't get permission to keep him, the insurance companies were closed, they might not get paid. I knew that. Not everybody would have known that. I did. Clearly, I wasn't going to take him home. So I spent my day with Dad. Sometimes he'd get up and want to walk up and down the halls. He was seeing bombers in the sky and setting type all at the same time. He was basically reliving the occupations that he had had in his life. And then the doctor would come in and say, "Oh, you must take him home." But what the doctor said was, and this is important for how doctors see the elderly: "Look, dear, he'll be better off at home, because when they are confused, this is what happens. When he's home in familiar circumstances, he'll be fine." Well, I knew better than that. First place, on his door was a sign that said, "Nothing by mouth." No drink, no water, certainly no antibiotics, nothing by mouth. I didn't know how to give an IV. That's a skill, folks. So we spent the day arguing. At one point, I did think to call my sister-in-law in California. And while she was 3,000 miles away, she was a head nurse. She knew how to deal with doctors, and she was a tough cookie. Well, she put that doctor in his place, and finally, after talking to her, he said he can stay. Dad ended up staying 4 days in the hospital. He stayed there longer than he did when he had his quadruple bypass surgery. Okay. And after that, he was in rehab for 2 weeks, where he had to learn how to swallow properly again. The important thing for you to remember with this piece of the story is that he was old and they wanted him home, but that the excuse that they gave, which I'm sure they give to lots of people, is they get confused when they're in unfamiliar places. Dad was having hallucinations. This, by the way, is why I stress in my book that it's so important to at least know of someone. Interview nurses, hire someone who you will have on hand as a medical advocate. So if something like this happens to you, a loved one, that there is somebody who can come in, like my sister-in-law did, and deal with the doctors.